feel really proud to be a part of this panel discussion today, and I feel really honored. I believe all four of you means a world to a parent whose child is autistic. First, we have Kristen Belloni, a strong healthcare service professional skilled in psychological assessment intervention, neuropsychology, public speaking, and curriculum development. We also have Sailaja Golla. Dr. Sailaja Golla is a clinical associate professor at University of California, Irvine School of Medicine and is pediatric neurology specialist and neurodevelopmentalist with national and international expertise in the field of autism. She currently practices at Thompson Autism Center, CHOC Hospital in Orange County. She is a director of the Fragile X Clinic at Thompson Autism Site. We also have Mariana Steele-Smith, CEO of United Rocks, a non-profitable organization, a youth rock climbing team, which serves kids aged from 3 years to 28 years with intellectual and development disabilities. Next, we have Maria Kristofic, Senior Director at Autism Speaks, non-profit organization, budgeting, event planning, new business planning, and fundraising. Thank you everyone for taking your time out. I would like to kickstart this discussion with Kristen Belloni. Can you let us know a little bit more about autism and what parents need to look in terms of signs and symptoms?
Things that parents should be looking for would be gaps in social communication. This would include things like poor eye contact, not using appropriate gestures. They may have difficulty with changes. So change in routines, change in the environment may cause a lot of distress.
So does that mean that these symptoms start surfacing at the age of 2 on an average too?
You may see symptoms way earlier than that. You may see an infant that will not establish eye contact or actively avoids eye contact with anyone. I use various assessments in my testing process, but some of the assessments go down as low as 12 months of age. So, if it's real obvious and they're 18 months old, and they would benefit from early intervention, then the diagnosis can be made. If they're meeting the criteria for the diagnostic criteria, the diagnosis can be made earlier to encourage the therapeutic process to begin.
Dr. Sailaja, I would like to ask you, what kind of primary care a pediatric or a family doctor start with an autistic child?
So the primary caregiver could be a pediatrician or a family care doctor who takes care of all ages. So they are very critical, a key player, because the child and the family first goes to their primary care physician for any concerns, whether it be speech or any red flags of autism. So they need to be aware of who to refer, what are the signs they need to look for, what are the red flags to look for, like Dr. Belloni mentioned earlier, and also lifelong management, because they'll be the to-go-home person. If the child needs a referral for a speech therapist or a psychologist or an ABA therapist, they will be the primary person. So it's very important for the family to know that there is a to-go-home, which is the pediatrician, who is kind of involved with connecting with all the other providers dealing with autism.
So is there any triggering point that make unborn child to be born in such manner?
To answer your specific question in the unborn child, like say a mom is pregnant and she comes that I'm concerned. So we would ask, why is she concerned? Is it could be like older age, like 35 plus years. They are prone to certain syndromes if they have a child at an older age. For example, like Down syndrome, which is one of the causes of autism. And there could be some other maternal distresses. There could be mom is on some medication. She could have some physical or mental injury, or maybe some other complications with pregnancy, a very premature child or a birth injury. So those are all some causes for a neurodevelopmental condition in general, which also includes autism, I would say.
I wanted to ask Maria, how do you cater the need of autistic child and its parent, and what kind of challenges do you face?
When a family connects with us, They may need help with insurance. They may need help with relocating. They may need help with other service providers that are near them. And so wherever they are in their journey and dependent on what that need is, we're there to support them along the way and provide them with those critical resources and guidance that they would need to be to best support them and their family.
Okay. So do you encounter strange requirements from parents?
No, not necessarily. I think that in my encounters with a lot of families, I've typically dealt more so with grandparents or aunts and uncles that may not be familiar with autism spectrum disorder, or may not feel that the parent or guardian may be managing or caring for that person in particular properly. But I think it's more so because there just needs to be a little bit more of an awareness of what autism is, and educate that supporter, that network that we all critically need around us a little bit better, so that they understand what it could be like, and just ensure that they know that right now, I think the best thing is to just be supportive, be there, and help when needed. So a lot of what we encounter are just trying to be better assistants and educate those, grandparents and cousins and uncles and whatnot that are not there on the day-to-day.
I have a question, Preeti, if you allow me, for Maria, because she said that parents and the families come with different requirements, and one of them can be a financial requirement, because that plays a critical role. My question here is how supportive the community is, or these people who come forward on their own to do the fundraise or help you out with the fundraise. Is there enough awareness still there?
I think from a fundraising perspective, what I like to mention to a lot of people is that the more funds that we receive, the more families that we can help and support. A lot of folks are not aware of all the things that Autism Speaks does, not only to support families in the community, but also to provide and support service providers that are moving the needle forward within their community to support those families that may have someone on the spectrum. And so we provide them with financial grants, which is critical for them to continue doing their work. We provide families with hardship grants. So for example, COVID, when all that hit for a lot of us, or for everyone, a lot of our families struggled significantly with financial support. And so Autism Speaks was able to alter, either research or support for service providers to particularly help those families with financial support. If they needed to pay their rent, if they needed to buy groceries, we were able to do that because of the fundraising that was continuing to happen. And so that helped our families significantly and continue to this day. And so that's why fundraising is such a big piece of it, but the fundraising can't happen until the awareness piece is happening and the community comes together to support each other and to kind of, hold hand in hand in all of these events or whatever venture it is that they like to partner with us.
Finances play a huge role to support these kind of cause, and this is not a very generic cause, it's a very specific one where you need to educate people. So yeah, we really appreciate that people like you are working towards it. Yeah.
I don't know why, Nanda, I feel that you have this personal interest in this campaign.
So there is no specific reason, I would say, that, I do not have, so far I do not have a friend or somebody who has an autistic kid in the family, or whatever I have seen in general community kind of awareness which need to be created in society and community about these kind of disorders or behavioral issues which child goes through, because when a child goes through it, the whole family also goes through it. If somebody is pointing out their parents that, okay, whose kid is that, and then where are the parents and why they have kept him like that or her like that. So these are the things which bothered me, and then I started educating myself first because awareness starts with each person taking responsibility for themselves. I think I'm developing interest towards it on my own, and then it's my personal, I feel that this is how we can give back to community too, and this particular cause or this particular interest of mine can help. At least one or two family also can make a difference.
Absolutely, Nanda, that you use that word click. That click has to happen, that click. That is why we all are here. We have to create that click globally so that people are more aware and come forward towards the inclusion of such children. So let me take it forward and switch to Mariana. She's doing an incredible job and she came up with lovely idea, and I want to know, Mariana, how did United Rock was created?
We started it, my oldest son is 20 now, and he used to be in a competitive rock climbing team for 7 years. And then youngest son, I had a youngest son now that he's 4 years old and has Down syndrome. So we found out an hour after he was born that I had Down syndrome. We made all the testing and everything was okay. The doctor said it was okay. So it was a little bit of a shock when we heard the news. And then we didn't know what to do. We didn't know what to expect. Of course, a child with special needs, we had no idea what to do. So my husband and I started thinking about what can we create for his future, because he's always going to need, assistance and, help. So we started researching about rock climbing for kids with special needs, and nobody else is doing this in the US. So I saw how my oldest son doing the rock climbing with the team. He was more independent, more focused. It helped him a lot with social skills and, being more aware of everything. So we said, well, why don't we try this? So we started doing rock climbing for kids with intellectual and developmental disabilities. So that's how the idea came to life.
So and I was not knowing that there is no organization like that, and you're the first one to start. So congratulations on that, and
thank you.
Amazing job, to start this kind of organization.
My next question is to Christine. Since soon after the parents know about their child, that probably the child is differently able, how do you deal with the parents' emotional meltdown? Because I understand it is very difficult. It is tough pill to swallow that their child is differently able. So how do you deal with the emotional meltdown of parents?
For the most part, people are very accepting of the diagnosis because it gives them some answers as to why their child looks different. And it helps identifying what the issues are and what the symptoms are is really what we need to do in order to initiate therapy and know what goals to work on and things like that. And I think parents need to really, and I stress this when I have feedback sessions with the parent to go over the diagnostic report, I stress that they need to also take care of themselves. They have to find respite time, especially when the children are really, really, behaviorally difficult. And there are some, I've met with some that will cry all day long. And, that can wear on a parent, and it can cause difficulties in the relationship with the parents and the marriage and all of that. So they really have to make a point of taking care of themselves as best they can. And a lot of times, if they don't have friends and family that can be around for support, they're gonna have to seek out community resources. And I'm always trying to find new resources because I find there's a lot out there for the children, but not as much for the parents.
Does that mean we have counseling sessions also for parents in place?
We don't actually offer therapy in our office at this time. We do the diagnostic testing and make the diagnosis, and then we make recommendations for treatment, whether it's counseling, ABA therapy, which is very popular for children with autism. occupational therapy, speech therapy, maybe even physical therapy. But yeah, as far as counseling, that would be something that parents would have to seek out.
We can just take this discussion to our other two participants also, Dr. Sailaja and Priya. Yeah. So what do you have to say there? Because you must be facing a lot of such situations where parents break down emotionally, or they how do they do they share anything with you all, or how does it happen?
I think it's very important for us to feel through their shoes, and also for our children and for in general the community also to learn a lot about autism. Though we have a lot of resources and diagnosis and education and special sources for the autistic children, what do we do as a community? Like, say, if a child, a normal child is just staring off at an autistic child. So how do we teach our children? So in the home library, include a book about autism or special needs, or how to include them, maybe invite them for birthday parties. There are some children who never got invited for a birthday party. So make them feel inclusive and be a part of them. Having resources specifically available for parents to deal with their emotional turmoil, or how do they deal with it. And also there are programs specifically for parents, like Dr. Belloni and Maria was mentioning. I really like the slogan this year, not just being aware, not accept. So we started off with awareness, and now we're accepting, but now to include them as part of our community. That's really optimistic and promising.
Thank you, Dr. Sailaja. Since you were talking about resources, I wanted to continue this and ask a question to Maria. I wanted to ask you that what kind of challenges do you face? Like, I'm specifically looking for some different challenge than a generic one you have faced recently, or which has impacted you a lot. So we want to hear from you.
A lot of our families that have private insurance have been receiving support for quite some time now. And actually Texas was the last state to pass that Medicaid will be, providing or ensuring that ABA therapy or therapy is paid for to a certain extent. So a lot of our families that we do get phone calls from are on Medicaid, but they're not getting the services and support that they need for their child. So it's been quite difficult because there's not much that we can do from our end, specifically when it comes to specialized therapy. A lot of what Autism Speaks does is we do provide like a 100-day toolkit, right? So when the family is newly diagnosed, what do I do? And I think Maria now mentioned that, like, there's so much that you could go on the internet and just Google and find, and it's just misinformation, and it can take you to a very far place. But a lot of what Autism Speaks does is once the pediatrician or the doctor refers them to us, we're able to provide them with that 100-day toolkit. It's like, they call us and say, what do we do? Well, here's that toolkit that has been created, vetted by either an adult on the spectrum or parents on the spectrum, by those professionals within the pediatrician facilities or doctor's offices that can really share with you what you and your family need to do the next 100 days. And so that way it provides them with a little bit of comfort, in a sense of they at least know what direction they need to go. And so that kind of helps them and guides them right off the bat. But then when it comes to what I mentioned earlier from the insurance piece, I think now we're starting to see that with Medicaid allowing or accepting that as a insurance for families have a sense of relief, and now they're getting that therapy that they need, because we know that the treatment is providing them with some type of support, and the outcome is better for those on the spectrum. And so it's great to see that as a community we're able to kind of legislatively push that we need this support for families. And then, like a lot of you have mentioned, when we come together as service providers or as support for the community. When we speak to each other and connect with each other, we're ensuring that that family is getting the best support that they need. So that's why conversations like this are so important, but to know of each other and what we do and how we can best provide that support is crucial as well.
So moving forward, can we have a concluding line from each one of you?
The more of this that we can do, the better we can serve the autism community and obviously heighten the awareness and acceptance of it.
Not just be aware, accept autism, but also please be inclusive of those children and adults with autism and have them be part of our community.
Rock climbing is just very, very beneficial for your body. It's a low impact exercise, so it's good for your body, especially your joints, and it promotes physical skills, mental skills, social skills, focus. It helps you in hand-eye coordination.
Just want to make sure that, again, like most of you have said, that we're super inclusive of our autism community and that we're providing the best support for them so that they can have a great journey and a successful, life.
And the only thing I believe, and I just try to say, is this is not about being a child, but child not being to be able to be child and accepted in the same way. So normalization is very much important in society, and inclusion is the important, and that's the key.
Thank you note for each one of you, because I don't want to meet everyone next April. I want to keep on meeting you. So
please go ahead.
I don't want to get activated 2023 April. No.
So please go ahead with your thank you note if you have
yes.
anything to say. Yeah, we would like to hear from you.
You need to come to Dallas so you can go climbing with us.
I would love to.
I agree. Yeah.
Okay, the meaningful change is hard, slow to come, and is often achieved in the face of adversity. Taking many small steps all over a long period of change will definitely make a difference in the world of differently abled individuals. I thank each one of you for your participation and contribution towards the cause. Thank you so much.